Good morning, Las Vegas. This is A Healthier Tomorrow. I'm your host, Will Rucker, and I want to thank you for tuning in to this month's program. We are fast approaching the holidays. In fact, we just passed Halloween and we're headed to Thanksgiving. Can you believe it's November? We are headed to Thanksgiving and then Christmas. With that in mind, I want to just encourage you to think about your choices. Think about what you're eating, what you're consuming, what you're spending your money on, and choose to make decisions that lead to a healthier tomorrow. This program is brought to you by Community Partners for Better Health. It's one of our outreach efforts because we are dedicated to improving the health of our community. This program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Learning how to manage your diabetes may seem overwhelming unless you know where to go for help. If you or someone you care about is living with diabetes, our free classes, online diabetes programs, and resources are designed to help you live healthier. Check them out at www.gethealthyclarkcounty.org. And now, joining us from the Clark County Health District is none other than Rayleen Earney, who is a health educator who has been with the Southern Nevada Health District for 23 years. Good morning, Rayleen.
Good morning, Will and listeners. Hope you're having a great day.
Yeah, thanks so much for joining us for A Healthier Tomorrow. It's always a pleasure to have you on the show. You're such a wealth of information, and it's just great. So, November is American Diabetes Month, and your work, of course, with diabetes prevention and management and just healthy lifestyles, I think is such a great asset. So, I wanted to make sure our audience was able to hear from you on this critical subject.
Greatly appreciate that. Absolutely. I've been at the district for 23 years and I've been teaching diabetes classes since 2010. So I'm just always happy to come on here to help people manage diabetes to reduce those complications.
Awesome. So then what is American Diabetes Month?
The month is a great opportunity to remind everyone to get checked out and screened for diabetes, which can be a very difficult disease to manage. So it's an awareness and also to remind people to go to their doctors. You know, we've been in a pandemic mode lately, and sometimes people are afraid to go to their doctors to get checked out. So this is just prime opportunity to remind people to do that.
Yeah, so if you've been avoiding the doctor because of COVID, now is a good time to go back and get checked out, especially for diabetes. So let's make this local for our listeners right here in Southern Nevada. How many Clark County adults have been diagnosed with diabetes?
Well, we do have about 11%, we say, of adults that have been diagnosed with diabetes, and that may not seem like a large number. However, last year we were only at 10%, so the trend is going in the opposite direction than what we'd like to see. And basically, about 13.7% of Latinos and 14% of African Americans have the higher prevalence of developing diabetes. So we're bringing this message to you to make sure that you're protected from this devastating disease.
You know, I definitely don't like to hear that, and it's frustrating because with so many different chronic illnesses and diseases, African Americans in particular are so hard hit by it. What would you say is, let me rephrase that. How would you go about helping people to understand the severity of diabetes?
I would just say that when people don't manage diabetes, they're at risk of severe complications such as blindness, amputations, and also heart disease and stroke. So if folks are not going to the doctors to get checked out, it doesn't mean that they don't have diabetes. So that can still be a threat to their health over time. So it's just very important. Kidney failure is also another complication of having diabetes that isn't managed well.
Yeah. So now we've talked about this once before, but I want to bring it back, and that is is prediabetes. And what is prediabetes?
Yeah, so prediabetes, it's a condition that a lot of people don't know about. It's when the blood sugar is higher than normal, but not high enough to be diagnosed as having diabetes. So for example, let me break it down to maybe a test result so someone could understand what that means. When folks get tested for diabetes, a fasting blood glucose test, then their blood sugar levels should be less than 100 for that test. And in prediabetes, the range is 100 to 125. So again, that's higher than normal, but not in the 126 and up range where it could be diabetes. One more point is that if a person gets an A1C test, that's an average of a person's blood sugar levels over the past 2 to 3 months. And if that level's at 5.7% and above, that could be the prediabetes range. So that's an estimated average blood glucose.
Well, prediabetes sounds kind of like, oh, it's not actually diabetes, but who's at risk for it, and what does prediabetes actually do?
Yeah, so prediabetes, you may not have any symptoms, but the folks who are at risk can be anyone who's overweight, could be someone who isn't physically active, getting the recommended 150 minutes of physical activity every week. And it can be somebody with a family history of prediabetes or diabetes. Women who had children who were born 9 pounds or more at the time of birth can be at risk of developing gestational diabetes. So that can be a condition during pregnancy. And if they don't manage their blood sugar, that could also be an ongoing risk for type 2 diabetes in the future.
Well, since there aren't really symptoms or signs necessarily for prediabetes, I think that just highlights the importance of visiting the doctor, getting tested, and making sure that you are in shape. If someone does, in fact, have diabetes, what are some signs or symptoms of that?
Sure. Some signs and symptoms of diabetes are frequent thirst. You just can't quench your thirst, in other words. Severe hunger, extreme hunger, and also wounds or cuts and sores that do not heal properly. So the blood sugar is too high, and then sometimes the body just doesn't heal itself. So those are some things that can be signs. Also extreme fatigue. A lot of people experience that, tired all the time, or even tingling hands and feet because the nerves, get damaged in our hands and feet. The heart has to pump the blood to our extremities. So if the blood can't pump effectively through the nerves, the cells, then it can't get to our hands and feet, and then that can cause tingling. So those can all be signs and symptoms of diabetes, and a reason for somebody to go see their doctor and ask them about it.
Yeah, that's interesting, especially that fatigue part, because of course, many people still suffer from fatigue due to COVID-19, and they could be, in fact, having diabetes and then just saying, well, I had COVID, so it's probably still that 6 months later. So just another reminder, get checked out so that you actually know what's going on with you. Last question I want to ask is really around how can we prevent diabetes? We've talked about prediabetes, we've talked about the impact of diabetes, but let's talk about how people can avoid even having to deal with it.
Absolutely. So there are a lot of ways to prevent or reverse prediabetes. And so some of those things can be remaining physically active, making sure you're moving throughout your day, even parking further from the grocery store, just little things you can build into your routine. Walking maybe after a meal can help bring down blood glucose. Also drinking lots of water. Water can be an excellent choice for people. Not drinking so many sugary drinks like the fancy coffees and some of the other sodas and things like that. We have a lot of recipes for flavored water that we have on our website, as well as the diabetes recipes as well. So folks with diabetes can actually cook healthier. When you cook from home and not eat so many convenience or fast foods, those are ways to kind of keep your blood sugar in check as well.
Those are great tips. I especially like just taking a quick walk after dinner A lot of times we'll eat and then get sleepy. But if we eat and then take that walk, not only are we more alert, but we're also doing something great for our health that could prevent diabetes.
Great
And
for mental health as well. Yeah, for
yes, oh,
sure.
that's so
For
critical.
depression. Hmm.
Thank you for mentioning that piece because that's really important too. One other piece I want to throw in is tobacco. If people quit using tobacco products, there's actually a decrease in risk for really any disease, but also particularly
Hmm.
diabetes.
Absolutely correct. So we always include a mention about tobacco in our tips because when people are using tobacco, of course, it just damages a lot of the cells in the body and leads to heart disease and stroke, and is also a co-complication of diabetes as well. So those things just, if once you quit, your body starts to heal itself almost instantaneously. You'll have others on the show I know that talk about, 2 to 3 months after quitting tobacco, then the heart starts to heal and different things like that. So people don't realize that a lot, and that those are some of the tips I really like. So we always talk about going to 1-800-QUIT-NOW to make mention of that quit line so that people can, if they're already using tobacco products, they can quit. And if they haven't started, please don't start that now. So that's a great quit line to use.
Yes, great tips. And 1-800-QUIT-NOW is certainly a great resource. What other resources are available for people who want to manage their diabetes or work towards preventing it?
We have wonderful tips on our website. So I want to give a shout out to gethealthyclarkcounty.org. And on there, we have online diabetes prevention programs that are totally free to the public. We have them available in English and Spanish, and people can learn the lifestyle tips that we're talking about to lose some weight. Maybe just 10 to 15 pounds could really help someone in preventing prediabetes and type 2 diabetes. So that could be something great. I also facilitate free diabetes self-management classes. They're very educational, and we teach them in 2 hours 1 week, and then the following workshop 2 hours again. And then folks get a lot of great resources like recipe booklets and some stretching bands, things to help them keep active in their normal daily routines. And I follow up with them and provide them a lot of support as well. There's an app called Map for Health that we encourage people to use, and the health district actually picks up the subscription for that app. So that's really a nice incentive for people to take one of our classes.
Wow, well, you've got me interested in coming for the stretch bands and the app. So that is so awesome. Well, Rayleen, thank you for joining A Healthier Tomorrow. It's always a privilege to talk with you, and you have such great resources and information. So another friend of the show also facilitates some of those self-management classes. And so we will hear from him next. Before I bring on our next guest, I want to encourage all of my Black men out there to join me on November 18th, starting at 7 p.m. at the Masterpiece Barbershop on Bonanza. We are having a men's only listening session. It's called the Men's Room, and this is especially designed for my Black brothers. So I encourage you to come on out. I promise you will leave edified. You will leave feeling absolutely empowered. It's your chance to talk to other Black men about what Black men are going through and dealing with and overcoming and succeeding in. I mean, we talk about it all. So November 18th, starting at 7 p.m. at Masterpiece Barbershop, join me there for an incredible time of conversation and fellowship.
Our history, the African American history, is not only filled with struggles and tribulations, but also triumph and pride. We have fought hard to be here today, and we must celebrate who we are and what our future holds. We've come too far to let ourselves become just another smoking statistic. We can't afford to be victims of tobacco. Right now, 45,000 African Americans die from smoking-related illnesses every year, and more African Americans die from lung cancer than any other type of cancer. The time is now for us to live smoke and vape free. Live smoke and vape free for yourself, for our future. The time is now we quit. Why? Because we matter. For free help quitting smoking or vaping, call the Nevada Tobacco Quit line at 1-800-QUIT-NOW. That's 1-800-QUIT-NOW. 1-800-784-8669. Or visit becausewematterlv.org. Because we matter.
All right. And with that, I would like to welcome Richard Davis to A Healthier Tomorrow. Good morning, Richard.
Good morning. How are you doing today?
Doing just fine. Thank you so much for asking. And thank you for hopping on to talk to our audience about the many things that you are offering. We were speaking with Rayleen about diabetes and self-management. And I was like, oh, this is perfect because of Richard's programs and all the different resources he offers. So for our audience that may not have heard you, because it's been a little while since we've had you on the show, if you could just share your role and some of the things that you do in our community.
Well, I'm a community health worker with Dignity Health, St. Rose Dominican Hospitals. And I apologize if it's a little noisy in the background because I'm always doing something. And today I'm at a conference on suicide prevention with the Nevada State Office of Suicide Prevention. But my main role is to help people to live healthier lives while living with chronic conditions, especially lung health conditions like chronic obstructive pulmonary disease, or COPD. I also assist people to enroll in Medicare and Medicaid. And those are important parts of staying healthy because unless you have access to healthcare, it'll be hard to maintain health. So just some of the roles that I play.
Yeah. So with the Medicare enrollment, is that happening now, or when can people investigate that information?
Yes, Medicare enrollment is right now until December 7th. Give the Medicare Assistance Program a call. That's a program that's through the state of Nevada that has been granted to Dignity Health to assist people in the community to enroll in Medicare.
Awesome. So don't wait till December to do this. Start right now. Get your enrollment details underway right now. So thank you for mentioning that, Richard. And I also wanted to bring up some of the classes people can take as we're entering into the holidays. Of course, we need to be just mindful of healthy eating and staying active. But you offer a variety of health classes that people can enroll in. Could you share a little bit about that?
Sure. Our self-help management programs help people, especially if you're living with any sort of chronic condition. That could be diabetes, could be chronic pain, could be a lung health condition, it could be a mental condition. Those things can impact our overall health. For example, people living with HIV, they've always been very focused on maintaining their health with HIV, but now that they're living normal lifespans with the new treatments, now they have to start thinking about diabetes and heart disease and cancers. So we want to maintain our overall health while living with any chronic condition to prevent other conditions from arising because of inactivity or poor diet, our depression, our stress. And these programs really help people to live a totally healthy life while living with chronic conditions. And then we also do our mental health programs to help people to deal with mental health issues such as stress and depression. And for example, there's a lot of crossover. So Pastor Brian will be talking to our Better Breathers Club in December about dealing with holiday blues and how that can pull you down and how to deal with that so that you don't go into stress or depression during the holidays.
Oh, that's so important. Yeah, the holidays, as much joy as we have, it's also very difficult for a lot of us because of loss of loved ones or just loneliness, a number of factors, less light happening in the day, the sun isn't out as long. So important. How do people get in contact with you to find out where this Better Breathers Club is?
They can call me directly at 702-616-4918. They can email me at richard.davis@dignityhealth.org. It's that simple.
Perfect. Give us that phone number one more time.
702-616-4918.
Wonderful. Well, Richard, thank you so much for joining A Healthier Tomorrow. It's such a privilege to talk with you. And I cannot let you go before we talk about two things. First, you are a recent award recipient for being an amazing human. Tell us about that.
Well, it was actually for continuing the healing ministry of Jesus, which is one of the missions of Dignity Health St. Rose. And that was, I was honored by Elder Help of Las Vegas, a wonderful organization that does a beautiful job networking with all the different senior health providers to provide services for seniors, especially in the African American community here in Las Vegas. And I was so surprised and honored to be recognized by them for my work. And it was a wonderful evening. And I just want to thank them so much for honoring me.
Yeah, well, I'm not surprised because Richard, you are a gem in our community and you work tirelessly to help everyone just live better, healthier, happier lives. And I'm just grateful to have encountered you and benefited from being in your presence and learning from the master, Richard Davis. I also want to bring up something called Scale the Strat. So we're a little early, but you are a veteran of Scale the Strat, which is the American Lung Association's climb, where we literally climb all 1,000 plus stairs from the bottom to the top of the Stratosphere Tower. So this is going on how many years for you?
I was realizing it was actually since 2010.
Wow. So this will be 10 years for you because we missed 1 year due to COVID, but you're still doing it. So I want to invite everyone out to the event. It'll be in February. We'll share more details as it gets closer, but Richard has climbed more times than me, and he's got me by a few years, but he still manages to do it. So I just wanted to highlight that and say, Richard, not only do you help our community in that way, in all the classes that you offer, but you actually participate in fundraisers and you stay healthy and active yourself going up all those stairs.
If I preach it, I got to do it.
Awesome. Well, again, thank you for joining the show. Is there anything else you want to mention to our audience?
Just stay healthy and stay active, stay involved in your life, stay involved in your health, and get insured.
That's right, before December 7th, so that you are covered for 2022. Can't believe we are talking about the year 2022. Unbelievable.
Oh, and get your flu shot and get your COVID shot.
Yes, thank you, Richard. Flu shots are happening now. And if you don't want to make 2 trips, yes, you can get your COVID and flu shots together. So make sure you stay healthy this holiday season. Richard, thank you for joining A Healthier Tomorrow, and we'll have you back again at the top of the year.
Thank you so much.
The A Healthier Tomorrow program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. The Road to Diabetes Prevention is a free online program that may help you reduce the risk of developing type 2 diabetes by learning how to make simple lifestyle changes. The program is self-paced and includes resources to help you live a healthier lifestyle. To learn more and sign up for the program, visit www.gethealthyclarkcounty.org. Well, that's our program for the month. Thank you so much for tuning in. As I always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And yes, what you do matters. So live compassionately. This has been A Healthier Tomorrow. I'm your host, Will Rucker, and I look forward to seeing you again right here on KCEP Power 88.1 next month.
They say it's difficult to quit smoking, but we African Americans are no stranger to hard work and determination. It's easy that we are not used to. Throughout our history and still today, we continue to fight through adversity and injustice, including being targeted by tobacco companies. No longer will we be silent about the negative consequences from smoking. Now is the time we celebrate who we are and what we've become. We will fight against discrimination and judgment, in part by prioritizing health and valuing life. Quitting is hard, but not quitting is harder. The time is now we live smoke and vape free. Why? Because we matter. For free help quitting smoking or vaping, call the Nevada Tobacco Quit line at 1-800-QUIT-NOW. That's 1-800-QUIT-NOW. 1-800-784-8669. Or visit becausewematterlv.org. Because we matter.
The only thing that scares me is when you don't wear me. So please don't